Hi, my name is Raymond Severa. I'm a respiratory care student at Miami-Dade College, and today I'll be demonstrating step-by-step procedure on how to orally intubate a patient with an endotracheal tube.
Hi, my name is Kelly. I'm a student at Miami-Dade College, and I'm going to be assisting Ray in patient intubation and securing patient device.
Alright, first things first, we want to make sure that we do have physician's order, and we do. Identify the patient, and by looking at the medical record number, and or the name and date of birth. And there is it is charted in the patient's chart that there is an order for endotracheal intubation.
Okay, so first let's just go ahead and assemble and gather our equipment. We're going to need the appropriate PPEs, the gown, gloves, in addition a mask, which for video purposes we're not going to be wearing, but you will need to wear a mask during intubation. You're going to need a stethoscope, and you're going to come over here and have a BVM. You want to test your BVM at this time, and put it at 15 liters per minute and see if the bag completely inflates. Okay, you can see that this is working. Also as well in the suction canister and the suction regulator, you're going to also assess that it is at no more than negative 120 millimeters of mercury. And you're also going to use a suction yanker just in case you need to suction the patient during intubation. So now that I have made sure that all of my equipment is ready for intubation, Ray's going to describe the rest of the equipment while I go ahead and prepare hand sterilization.
At the same time, we'll also perform sterilization.
You want to make sure that it dries, and then you can put on your gloves.
Alright, so the rest of the essential equipment you're going to be needing is an airway roll, which basically contains your laryngoscope and the appropriate size blades. Actually, all blades should be in there. And I'm going to select the laryngoscope.
Here you go, Ray.
And let me see if I can find number size 3 Macintosh. Leave it so.
Go ahead and
I'm going to go ahead and check the laryngoscope, make sure it's working properly. It's a fiber optic laryngoscope. So, alright, there is a good light there. And I'll be using a size 3 Mac, and it's curved as you can see. I also have tape here to secure the endotracheal tube once I have the patient intubated. I have a 10 cc syringe which I will use to fill the pilot balloon up with air, which keeps the cuff in place. And we got endotracheal tubes. We got 3 different sizes. Basically, the size that I determined would be best appropriate, and a size above and below in case there's any complications. Got a stylet here to maintain rigidity in the ET tube when you're actually inserting the endotracheal tube. Got an end-tidal seal tube, colorimetric, so, you know, gold is good, purple poor. Got OPAs, manometer. This is to check the actual pressure inside the inflated cuff.
And as what Ray was describing the rest of the equipment, I made sure that the equipment is ready for intubation.
Is that ready?
Yes. Not letting it go past Murphy's eye. So everything's ready.
Respiratory rate and his pulse. First, I'm going to start with the pulse, so I'm going to assess the rate, rhythm, and quality. It's 60 regular and normal. I'm going to check his lung sounds and listen to the respiratory rate, rhythm, and quality.
Okay, while Ray is patient, putting a towel underneath the patient to align for intubation and preparing, as well as hydroxygenating the patient.
Alright, I went ahead and recorded the patient's respiratory rate. It was 10, regular, and very shallow. I'm going to get my laryngoscope, hold it in my left hand. Already have my blade attached. Alright, as I instruct her to remove the BVM, I'm going to have her place something behind the patient's head. Do you believe we have a sheet somewhere?
Yes, as I stated, the towels for underneath to align for intubation.
Alright, so you can go ahead and I'm ready to intubate. I'm going to go ahead and grab some lubricant. Thank you. Sprayed on the tip of the UC tube. Take out the OPA. Insert the laryngoscope.
Intubation time should take no more than 15 seconds. As Ray is intubating, I'm assisting and monitoring the patient for any noticeable changes.
I'm visualizing the tube passing through the vocal cords. And I went ahead, when I entered the laryngoscope, I swept the tongue from right to left. Remove the stylet.
Then remove the stylet and insert the cup.
Get that anti-suit too. Alright. Just disconnect real quick. Touch. Yeah. Big end. Yeah. Alright, just hold one hand with the tube, one hand on the BVM. Go ahead and check lung sounds.
Again, not to let go of the tube so you don't lose airway. Intubation is confirmed by bilateral chest rise and capnography.
Yeah, basically the patient's got good bilateral breath sounds, negative epigastric sounds. Its correct placement could only be confirmed by radiography, so the patient's going to need a chest x-ray. Until that time has come though, I'm going to go ahead and secure the ET tube in place with tape.
While Ray is securing the device, I will keep bagging the patient.
Want to take the top piece of tape, place it on the upper lip, and bottom of the tape. Want to wrap around the tube and secure it. Obviously you want to note where the tube is placed depth-wise, and you want to note it as to what your landmark is, whether it's the teeth or, you know, the lip. And this patient is 26 at the teeth. And grab another piece of tape I have back here just to make sure it's secure. good time to go ahead and reassess vitals. Go ahead and check the patient's respiratory rate, note their rhythm quality, check breath sounds, and also the rate should be controlled by the person actually administering it. And note the rhythm quality too and lung sounds as appropriate. And any other appropriate vitals that we may have. End-tidal CO2 does look good. It is bold.
That completes. We're also going to check cuff pressure.
And you want it underneath 25 millimeters of mercury. That's the most that it should be at. And it's at 22, so it's good right there where it's at.
That completes the intubation procedure.
We'd like to thank you, and we're going to go ahead and appropriately discard all contaminated equipment and remove our PPE. Patient is now being taken over by another team, so patient is still being bagged and everything. We're just going to go ahead and discard all equipment.
The patient is safe.
And we're going to make sure the patient's comfortable and before leaving the area.
Discard from the PPEs. And away from your body in case you've got any contamination. Going to go ahead and wash your hands. And we are going to go ahead and go to the patient's chart and record the procedure was done.
Double check the chart and make sure everything's been noted.